Thank you so much for joining us today. This is the second to last for this year, My Health Matters Education Series, and we're appreciative that you've made it, despite the fact that I may have told you to go to the wrong place. But they are going to be here at Sugar Rec Center. We have one coming up in September. What's our date in September?
I'm not sure yet.
Okay, we'll get back to you on that.
Do you know the topic?
I guess it's going to be on Parkinson's. Okay, so. But we partnered with Covenant Health. I am Heather Micah. I'm the owner of Citizens Insurance Solutions, and everybody I think here knows me, but I live here in the village, been here about 3 years. I represent every health and life insurance company in America. We're in about 29 states. Been doing this 29 years. So, winky dink, I guess. But I'm very happy to turn this talk over to Nikki. Nikki is with Thompson Cancer Survival Center. She's the outreach coordinator, and she's going to give us lots of good information. You will see in your folders some information about cancer. I just put a few tidbits about costs.
Yes.
Even with insurance, people can expect to spend on cancer treatment up to $10,000 per year on out-of-pocket related covered medical expenses. There are also indirect, yes. It's because, the co-pays for things are big. Drugs, that's one of the reasons. In fact, about 25% of people who are diagnosed with cancer end up having to file for bankruptcy.
25%?
Yes. I'm hoping that it's like the younger folks. Of course, it's not our very well-planned Teleco villagers, but it can happen. And there's a lot of indirect costs related to cancer. So those are things like, you want to do something that's not covered by health insurance, or you need to travel, or you want to get a second opinion, or you got to get a hotel, or you got to eat 3 meals out, you got to park, you got to pay for someone to, take care of your house, mow the lawn while you're with your loved one. So there's a lot of expenses that are related to cancer. About 75, it used to be 80, I don't know if it went down, but about 75% of cancers are treatable. We've got about 23, there were 1.9 million new diagnoses of cancer according to the Cancer Institute of America. And we had about almost 700 deaths, so that's about 75% of people survived. So that means it's expensive, but it's treatable, and she's going to tell us some of the local resources that we have, so we're appreciative of that. There are things that we can help you with as it pertains to cancer outside of your health insurance, about $1 a day. As long as you've never been diagnosed with cancer, you can get a lump sum of cash. So you can talk to me about that after, but I'm pleased to introduce Nikki.
Awesome. Thank you. Well, thank you for having me. This is a great place. I have never been to Teleco Village. I've always heard about it and lived in Knoxville since 2005, but have never been this direction.
Welcome.
Welcome.
Yes. Thank you. So, for you all, did you move here recently, or is anybody from this area?
No, although we do have a fair number of people who moved from Knoxville or Maryville or other parts. I've been here, I can't believe it, 6 years.
Wow.
A little fast.
So, where are you from?
Originally Illinois, but most of my adult life in Texas.
And came here just for Teleco Village?
Yes, and my family who lives here too, so I was familiar with it,
Gotcha.
visiting holidays type of thing, and just came here as a pre-retirement kind of.
Gotcha. I see you nodding. Y'all have family here too?
No.
And-
That's big draw.
Gotcha.
No, that's not true. That's not true.
I mean, yes,
We've
we
been here
can
for 3 years, but one of the main reasons I wanted to move here to be somewhat closer to my sisters, even though one's in Iowa and one's in Chicago. So, that was a big draw, but we lived in Alaska, so we were far
That's a
away.
huge.
And so, this has just been fantastic and no regrets.
Yes, East Tennessee is beautiful.
It's gorgeous.
Yes, yes. What about you all?
We moved here in September 2022. We had rented for 5 months to make sure this is what we wanted. We had been watching Teleco Village for a number of years online. We're from New York.
Oh, okay.
You go to New York?
Down Mississippi. Yep. She's from, where are you from, Buffalo?
Syracuse.
Rochester. We moved upstate when the grandchildren started coming. We grew up in Queens, lived on Long Island for over 30 years, and then upstate 2004 to last year. The reason we moved, taxes.
Stupidity.
I don't want to get into,
Oh,
yeah, government.
yes, the government.
I thought you meant moving here was.
No, we don't regret a thing. We
Good,
don't regret a thing.
good.
So we need information on resources in the area. We
Perfect.
have no family here. We have Virginia, Maryland, and Syracuse.
Well, how many of you all, whether it's through friends or family or even yourself, have been touched by cancer? So this is relevant to everybody, right? And what I'm going to do is bring you the information on what's available in your area, and some of it you just set me so nicely up for. So the first thing I want to do is just introduce myself. Again, I'm Nikki. I do outreach for Thompson Cancer Survival Centers and for Thompson Oncology Group. And so my job is very broad. I reach out and educate physicians and practices, then the community, and also kids in schools. I do an extensive program on vaping and tobacco cessation with kids, and then do in-reach as well to make sure that in our culture, our employees connect with each other and bring out the best in each other and celebrate our victories together. That helps us to deliver very good patient care if we have strong relationships with each other. So that's a little bit about me. The other thing that I want to back up and tell you about is a little bit of the history of Thompson. So way back, I believe in the 40s, there was a man named B. Ray Thompson who was from Scott County. So it's near here, it's in East Tennessee, but not quite where we are. And he grew up the son of a sawmill operator. And when he got older, he became the owner of a timber company and got in the coal mine business and eventually had over 10,000 employees in the area. Became a very wealthy business.
Right place, right time.
Yeah. So his second wife got cancer. And when she did, of course, he had the availability to take her to New York, to Memorial Sloan Kettering, which is what so many people do, right? They find out they have cancer, and then it's, what can I afford to do? Where can I afford to go to get the best treatment? So, they went through that. Eventually, she did pass away, but he started thinking, I have all these people under me, most of which could never afford to do this. They could never afford to go to a major cancer center and get the best care. I want to, in her memory, bring that here to East Tennessee. So he bequested a massive amount of money to form Thompson Cancer Center. And the goal back then and through today has been to bring world-class cancer care, the best of the best, like the big cities have, here to little old East Tennessee, Knoxville, and all the surrounding areas. So, if you look up here, we currently are located in all these areas across East Tennessee. We have 8 centers, 5 of which, the ones with the stars, are comprehensive cancer centers. And so what that means is that those locations offer all life-saving treatments, from chemotherapy and different drug therapies to radiation therapy, and beyond. Okay, so all the social services, which we'll talk more about as well.
I'm sorry, you're saying the ones with the stars
The
have
ones
the
with the stars.
comprehensive.
Yes, so the closest to you
Some
all
of them have.
would probably be West, which is at Park West in West Knoxville. Some people might like to go to Oak Ridge. It's not much different from you all, I think. But we also, as you can see, have services in Lenore City. It's just that Thompson does not control the radiation, doesn't have the radiation there. So we have an oncology group there though. So if you were to go to Lenore City to receive treatment, you would see the medical oncologist there and get things like chemo there, but you would need to go to the west location or the Bridge location to get radiation. Does that make sense? So, yeah. But again, the goal was for people to be able to receive cancer care in their own backyard and not have to travel. So that's what we accomplished. Now, of our radiation therapy services, we offer 6 different types of radiation. And we'll talk a little bit more about some of those in a minute. But what I want you to take away from that is bringing that big city care. There are all the options. You have all the options for treatment.
Spend on cancer treatment up to $10,000 per year on out-of-pocket related covered medical expenses. There are also indirect, yes. It's because, you know, the co-pays for things are big. You know, drugs, that's one of the reasons. In fact, about 25% of people who are diagnosed with cancer end up having to file for bankruptcy. 25%? Yes. I'm assuming, I'm hoping that it's like the younger folks. Of course, it's not our very well-planned Teleco villagers, but it can happen. And there's a lot of indirect costs related to cancer. So those are things like, you know, you want to do something that's not covered by health insurance, or you need to travel, or you want to get a second opinion, or you got to get a hotel, or you got to eat 3 meals out, you got to park, you got to pay for someone to, you know, take care of your house, mow the lawn while you're with your loved one. So there's a lot of expenses that are related to cancer. About 75, it used to be 80, I don't know if it went down, but about 75% of cancers are treatable. We've got about 23, there were 1.9 million new diagnoses of cancer according to the Cancer Institute of America. And we had about almost 700 deaths, so that's about 75% of people survived. So that means it's expensive, but it's treatable, and she's going to tell us some of the local resources that we have, so we're appreciative of that. There are things that we can help you with as it pertains to cancer outside of your health insurance, about $1 a day. As long as you've never been diagnosed with cancer, you can get a lump sum of cash. So you can talk to me about that after, but I'm pleased to introduce Nikki.
Awesome. Thank you. Well, thank you for having me. This is a great place. I have never been to Teleco Village. I've always heard about it and lived in Knoxville since 2005, but have never been this direction.
Welcome.
Yes. Thank you. So, for you all, did you move here recently, or is anybody from this area?
No, although we do have a fair number of people who move from Knoxville or Maryville or other parts. Yeah, I've been here, I can't believe it, 6 years.
Wow.
Flew fast.
So, where are you from?
Originally Illinois, but most of my adult life in Texas.
And came here just for Teleco Village?
Yes, and my family who lives here too, so I was familiar with it,
Gotcha.
visiting holidays type of thing, and just came here as a pre-retirement kind of.
Gotcha. I see you nodding. Y'all have family here too?
No.
That's big draw.
No, that's not true. That's not true.
Oh, yes.
We've been here for 3 years, but one of the main reasons I wanted to move here to be somewhat closer to my sisters, even though one's in Iowa and one's in Chicago. So, you know, I mean, that was a big draw, but we lived in Alaska, so we were far
That's
away.
a huge.
And so, you know, this has just been fantastic and no regrets.
Yes, East Tennessee is beautiful.
It's gorgeous.
Yes, yes. What about you all?
We moved here in September 2022. We had rented 5 months to make sure this is what we wanted. We had been watching Teleco Village for a number of years online. We're from New York.
Oh, okay.
You go to New York?
Don't miss it. Yep. She's from, where are you from, Buffalo?
Syracuse.
Rochester. We moved upstate when the grandchildren started coming. We grew up in Queens, lived on Long Island for over 30 years, and then upstate 2004 to last year. The reason we moved, taxes.
Stupidity.
I don't want to get into,
Oh,
yeah, government.
yes, the government.
I thought you meant moving here was.
No, we don't regret a thing. We
Good,
don't regret a thing.
good.
So we need information on resources in the area.
Perfect.
We have no family here. They're Virginia, Maryland, and Syracuse.
Well, how many of you all, whether it's through friends or family or even yourself, have been touched by cancer? So this is relevant to everybody, right? And what I'm going to do is bring you the information on what's available in your area, and some of it you just set me so nicely up for. So the first thing I want to do is just introduce myself. Again, I'm Nikki. I do outreach for Thompson Cancer Survival Centers and for Thompson Oncology Group. And so my job is very broad. I reach out and educate physicians and practices, then the community, and also kids in schools. I do an extensive program on vaping and tobacco cessation with kids, and then do in-reach as well to make sure that in our culture, our employees connect with each other and bring out the best in each other and celebrate our victories together. That helps us to deliver very good patient care if we have strong relationships with each other. So that's a little bit about me. The other thing that I want to back up and tell you about is a little bit of the history of Thompson. So way back, I believe in the 40s, there was a man named B. Ray Thompson who was from Scott County. So it's near here, it's in East Tennessee, but not quite where we are. And he grew up the son of a sawmill operator. And when he got older, he became the owner of a timber company and got in the coal mine business and eventually had over 10,000 employees in the area. Became a very wealthy business.
Right place, right time.
Yeah. So his second wife got cancer. And when she did, of course, he had the availability to take her to New York, to Memorial Sloan Kettering, which is what so many people do, right? They find out they have cancer, and then it's, what can I afford to do? Where can I afford to go to get the best treatment? So, they went through that. Eventually, she did pass away. But he started thinking, I have all these people under me, most of which could never afford to do this. They could never afford to go to a major cancer center and get the best care. I want to, in her memory, bring that here to East Tennessee. So he bequested a massive amount of money to form Thompson Cancer Center. And the goal back then and through today has been to bring world-class cancer care, the best of the best, like the big cities have, here to little old East Tennessee, Knoxville and all the surrounding areas. So, if you look up here, we currently are located in all these areas across East Tennessee. We have 8 centers, 5 of which, the ones with the stars, are comprehensive cancer centers. And so what that means is that those locations offer all life-saving treatments, from chemotherapy and different drug therapies to radiation therapy, and beyond. Okay, so all the social services, which we'll talk more about as well.
I'm sorry, you're saying the ones with the stars
The
have
ones
the
with the stars.
comprehensive.
Yes, so the closest to you
Some
all
of them have.
would probably be West, which is at Park West in West Knoxville. Some people might like to go to Oak Ridge. It's not much different from you all, I think. But we also, as you can see, have services in Lenoir City. It's just that Thompson does not control the radiation and doesn't have the radiation there. So we have an oncology group there, though. So if you were to go to Lenore City to receive treatment, you would see the medical oncologist there and get things like chemo there, but you would need to go to the west location or the Oak Ridge location to get radiation. Does that make sense? So, yeah. But again, the goal was for people to be able to receive cancer care in their own backyard and not have to travel. So that's what we accomplished. Now, of our radiation therapy services, we offer 6 different types of radiation. And we'll talk a little bit more about some of those in a minute. But what I want you to take away from that is bringing that big city care. They're all the options. You have all the options for treatment. Our employed medical oncology group through Thompson and Covenant Health is Thompson Oncology Group. We have currently 11 hematologist oncologists who are board certified and fellowship trained. What that means is not only did they go to medical school, not only did they specialize in oncology, but they got board certified, and then they spent extra years working one-on-one under another physician to earn that fellowship designation. And so you won't find that everywhere. That sets us apart from some of the other centers. We also have 2 gynecologic oncologists. So in addition to all that other training I was talking about, they also have spent extra years studying cancers of women's reproductive systems. So they, I'll show you them in a minute and talk just a little bit more about that. Now, another thing that makes us very stand out is that all of our locations have on-site oncology pharmacies. Now, you're used to going to Walgreens, CVS, whatever, to get your drugs, right? And when your doctor prescribes those medications, they are mixed according to a set of standard weights, right? Well, at most cancer centers, when you go, they have kind of a central pharmacy, and their chemo and their other medications are mixed the same way, according to kind of standard sets of weights. And then they're sent to wherever you're going to get your treatment for the day that you have your treatment. At our treatment centers, you come in for your treatment, you are weighed, you talk about your symptoms, your side effects, any changes you've had, and then your information is sent that day to the on-site oncology pharmacy, and they then mix your medications according to your specific situation that very day.
It's tailored for you.
It is tailored for you, and if you're having side effects or symptoms that are going on, they can talk about ways to address those right there. If it has to do with medication, then that can be adjusted right there. You don't have to wait or not have that option. The other thing that allows them to do is keep the doctors abreast of any new developments, any changes. It allows them to look at anything like cost or insurance that's affecting your ability to pay for those medications and research ways to help you with that, or maybe alter medications. They have all that knowledge right there. Plus, it puts in an additional layer of checks and balances to make sure that everything is right before it's getting administered to you. So it's really unique and special for us to have that. The other thing is on here, I have that we have over 20 clinical trials. Actually, currently we have 28 clinical trials open with 11 more in the pipeline. And so that means, like, if you have had treatment and it hasn't worked, you're not out of options. Even if you've not had treatment, your doctor can send your case to our clinical trials department. They will take all the information themselves and go through and see if you fit into any clinical trial. And you can have that information before you ever even start treatment. That way you can decide what's best for you, what you want to do. That level of clinical trial offerings is very unique. Most cancer centers do not have that many cancer clinical trials open. Again, bringing that big city cancer care here. We were actually the first people in East Tennessee to bring clinical trials. The first, over UT, over any of them, over 25 years ago. So we've kept up with that. That's a goal of ours. Okay, I told you I have 6 different forms of radiation therapy. I'm not going to go into all these. I'm just going to give you a 30,000 foot view, okay? IMRT and IGRT are kind of what you think of when you think of radiation therapy, where you lay on the table, it's external beam, it's kind of the standard for cancer radiation. Brachytherapy and mammocyte are both implanted pellets. So they're just used for different specific types of cancers, such as breast cancer, prostate cancer, things like that. Gamma knife. I'm going to talk a little bit more about that. Gamma knife is a special type of radiation that's used to deal with brain tumors. Okay? And it's not found at all cancer centers. In fact, we are one of only about 30 centers in the United States that have the latest technology in gamma knife treatments. We offer gamma knife at our downtown Knoxville location only, but all of our medical oncologists can consult patients for that treatment. So if you were going to Lenore City and you had a brain tumor, that doctor there could tell you all about it and decide whether or not that's a good fit for you before sending you there. Gamma knife is also, as the rest of radiation, non-invasive. It's not surgery like what you think of, no cutting. It's usually done in one treatment, and patients can usually have the treatment and the next day be at the same level that they are, of performance. So, that doesn't mean that they're going to get well and be able to go out and go back to work the next day or run a marathon the next day. But if they went in one way, they're not going to come out typically a lot worse than they were when they came in, right?
When you think of brain surgery.
Yes,
you think
yeah.
of that,
You think of something much more major.
disabling. Yeah.
Right. So that's a very special option. The other one, proton therapy, I'm going to talk more about it then because I'm going to tell you all about proton therapy. Okay, PET CT testing. Everybody familiar with what a PET CT is?
No.
Okay, let me educate you. So a PET CT is a type of imaging, okay? Just like it's a diagnostic imaging tool, just like when you get an x-ray or something like that. The difference is that PET CTs, they inject a radioactive substance into your body, and then they track that substance to see where in your body is metabolizing or using more sugar than normal, okay? Now, have you ever gone to have a test and you've been told not to eat or drink anything before the test?
Oh, always.
Okay, I'm not going to ask if anybody cheated, but I'm going to show you why you shouldn't cheat, okay? With PET CT testing, you're told not to eat or drink anything before the test. If this test is trying to determine where in your body is using more sugar than normal, why would you be told not to eat or drink?
So that it's different results.
Yeah, because it's going to show where something is being digested, right? Up here we have, so the images can come in color or black and white. I'm going to come in both, right? So up here, this is a black and white image of somebody that ate before they came in. So what do you notice about it in the middle?
Large black spot.
Yeah, one, right? One at the bottom, one at the top. It's because, if they just ate, what it's showing is where that food is currently being digested. And that's what that machine's going to focus on. Now this one right here is the exact same patient the next day having not eaten and having that scan. What do you notice?
Oh my gosh.
Oh,
yeah.
So all that is cancer. All those black spots. If you are told not to eat or drink before a test, there is a real reason not to do that. That's just kind of an aside, a little freebie for you to take.
Good visual.
Yeah, yeah. But one of the first ways to determine whether or not you have cancer, where the primary or originating site was, and whether or not you have metastasis or spread of the cancer.
Like this picture number 3 would indicate.
Yes, that would be metastasis, yes. We offer PET CT testing 5 days a week at our West Knoxville and our downtown Knoxville locations. And we have some very specialized forms of PET CT testing that we have just brought in and opened, such as PSMA testing, which is a much better form of detecting prostate cancer than a lot of the standard testing. And also we have special testing for neuroendocrine tumors. That's, again, a step up from what you will get at most places. Okay, another diagnostic tool we offer is low-dose CT screening for lung cancer. So you can see up here, it's available at several of our different centers, and one of them is right here in your backyard, Fort Loudoun Medical Center. Low-dose CT testing for lung cancer is not available to everyone. It's available to 55 and up, so I think we all qualify for that in here. But you have to be high risk for lung cancer. So that means you either have a history of lung cancer, you have had emphysema or pulmonary fibrosis or some other lung disease like that, or you've been exposed to one of the environmental, exposures that might make you more likely to have lung cancer, such as asbestos or beryllium or radon or, something like that. Let's see, this is something a little bit new to me to share, so make sure I covered it all.
Yes.
Yeah, and if you were a smoker of a pack a day for over 30 years, you can
And
also be.
I'll say, I've got a sheet that will list out every qualification to hit those markers, and this is one of the best ways to, we didn't have this before, years ago. And so people would smoke forever, and then at the end stage, they would find out they have lung cancer. This is one of the best ways. It's an early detection where you can get screened and find out within stage 1 that you can qualify for some treatment and have extra time and have a better chance of survival.
And that makes a huge difference.
Also, family history will also qualify you, because I just had that done because my sister has stage 4 lung cancer, has never smoked a day in her life. Then they caught it late, because she had no symptoms.
Yeah.
So I just did this really recently, and it's totally non-invasive, as you
Yes.
said. And, they did identify 2 little things, so then they sent you to a pulmonologist, and they said, it's nothing, they're 2 millimeters, come back in a year, go back and have it, do it again. But it is definitely worthwhile.
Yeah.
It's, first for me, it was just peace of mind.
Sure.
Yeah,
It's just peace of mind.
Yeah.
So,
for sure. Are there any other questions about that? I can't promise I can answer them, but. Okay. All right. So one of the things, and this just ponies off of what you were saying about the cost of cancer and some of the barriers to care. One of the things that makes Thompson, again, very special and very unique to this area are our patient support services. Those things that go beyond the medicine. We have a foundation called the Thompson Foundation that supports all of our patient support services. So they are offered at no extra cost to oncology patients. They are available to them for free. And we have different events that raise money for that, but also I think it's important for you to know that our own staff gives money into that. Because we care, we want our patients to be treated like we would treat our own family. So, let me go over some of those. You were mentioning genetic counseling, that you would have that testing. So that is one of the support services that we offer that's free to oncology patients. Our genetic counselors will meet with people who are trying to decide whether or not they should have the testing. They explain the testing, but they also will be candid and go over with you reasons for getting it and reasons you may not want to get it. Sometimes it affects like life insurance and stuff like that, things that you might not think to consider. They really help you think through. And then if you decide that you want to have genetic testing, they're going to arrange that. They're going to, facilitate that, and then when they get the results back, they will meet again with you, go through all of them, what they mean, what your options are, what your family's options are, stuff like that. Very, very hands-on. We also have dietary support. So registered oncology dietitians that meet with our patients before they start treatment to kind of tell them what to expect. And to also come up with a game plan for keeping good weights and dealing with side effects during treatment. Then they check in, they follow the patient's case as they're going through treatment at the follow-up appointments to spot any changes in weight that might be, red flags that they might need to intervene on. And then they will go see the patient and see what's going on, make plans that, kind of help deal with side effects or taste changes or weight loss or just anything that's going on. So that, again, free for our oncology patients. Clinical trials I talked about. Patient education, that's me. And oncology pharmacy I talked about. Now, for the oncology nurse navigation, I'm going to play a little video about that. And when I play these videos, I want you to know that the people you're seeing actually are our staff. And they actually are our physicians and nurse navigators, so you'll kind of get to know them in the videos. Our oncology nurse navigators are unique in that they are all certified in oncology. A lot of places will have navigators because that's definitely a profession, and they don't have to be certified in oncology. Ours specifically are. So they are tailored for our patients. So.
Hey Nikki, can I ask a question about the
Yeah.
genetic counseling?
Yeah.
If you're not currently an oncology patient, could I call down there and say,
Yes.
hey, I'm just a person in the community, I'd like genetic counseling and testing?
Yes, yes, you can.
Okay, thank you.
And honestly, I'm not sure about the cost if
That's
you
okay.
do that. Now, I know a lot of insurances will cover genetic testing if it runs in your family, so, but yeah, that's definitely something that you can, call and get more information about, so.
Thank you.
Yeah.
You mentioned about all these services, are they offered
At all locations, yes. And so, most of our patient support services are based downtown,
Okay.
but they travel to the other sites, and they also can all do Zoom appointments too.
Oh, sure.
So, yeah, the technology is kind of a nice thing.
Our physicians, we pretty much in every Thompson Oncology location are supported by our paid staff. That includes nurse navigators, that includes genetic counselor, that includes social worker, that includes dietitian, and we all are here to help beat patients' cancer.
So I think one of the unique and absolutely strong parts of the Thompson program is this glue that holds everything together from the team approach, and to me that's nurse navigation.
The role of a nurse navigator is we serve as the primary contact for the patients. We reinforce education, we help them navigate through their diagnosis. We can try to answer any questions they have and make sure that when the provider is there that all the questions they have are answered. I want to be the person that can remove barriers so that the patient can focus only on healing.
And we can reassure people, we have this. Your terrible problems you're facing, you're not facing it alone. You're facing it with a team of well-qualified, well-trained, highly motivated professionals that are going to take that burden from you and do all we can for you. We will not stop.
Yeah, so it's fun to see my friends all day. One thing that they did not say is traumatic diagnosis, right? And most people, I was just listening to someone the other day talk about how in their initial appointments, they go and all they hear is cancer. They don't hear anything else that's been said. Well, your nurse navigator will go to your appointments with you. And those nurse navigators sit and take notes as the physician is talking to you. They will put those notes in a form that you can understand, that's not so high level that when you get home, you're like, I have no idea what they just said. And then they give you their phone number to call anytime for any questions, any problems, any side effects. And they are fabulous about just keeping up with the patients. From then, they not only attend your appointments, but they arrange all the other appointments that you have. One thing I don't have in this video is that we have multidisciplinary tumor conferences like all cancer centers do, where for our cases, the doctors all meet together. So the pulmonologist, the radiologist, the oncologist, the pathologist, the radiation oncologist, all of them will meet together. The surgeons, yes, and come up with and discuss the plan for your case. And then for certain diagnoses, we actually have a clinic that we hold directly after that conference where the patient comes, and instead of the patient going to all these different appointments in all these different buildings and doctors, the doctors all, right after they've just discussed the patient, all together come to that clinic, and then one after another come in the room with your nurse navigator sitting there keeping track of it and taking notes and tell the patient what's going on. So we do that for breast. I think we do that for colorectal, but don't quote me just yet on that. But certain diagnoses, we do have that. But for all of the diagnoses, the doctors will meet, and discuss the cases, so they're all on the same page. So
That's good to have a collaborative approach. I think the Mayo brothers invented that many years ago.
Yeah.
And I know they still use it today. I think that's a great idea.
Yeah, they all have great relationships, and I actually sit in on those, so I know firsthand the relationships that they have and the ways that they work together, and it is fabulous. I would send my family nowhere else. So,
And Dr. Ashraf, the first doctor that we saw in the video, she's actually a Fort Loudoun oncologist. She has her office there upstairs in the professional building, and she also goes to Park West.
And it's another set of ears when you completely blanked out.
yes, yes. And not only to talk to you, but to actually give you written down so you have it for when you are ready.
Well, how many times people bring a support system with them because they just can't, when they're hearing words, they can't focus because they're in a state of shock.
Right.
And
Yes.
Yeah.
depending what your support system understands, you're better off with.
Yes. And I'm so glad that you just said that because it made me remember there was one patient support service that I did not go over, and that is social services. We have social workers on our staff who will not only counsel for the mental, component of having a diagnosis like cancer, but they will connect patients with the resources needed to keep getting treatment. So like when she was talking about the cost and how, getting there, parking, if you need a place to stay. Think about if you're still working and you can't work, how are you going to pay your bills? If you can't pay your bills, how are you going to even think about getting to treatment, right? So the social workers can connect patients with resources to fill those gaps in. And again, that's a service that's free to our oncology patients. Vital, vital service. So yeah. Clinical trials, I just want to play this for you because I want you to see our Director of Clinical Trials, Dr. David Chisholm. He is active in organizations all across the United States, very well versed in clinical trials. He's also one of the medical oncologists that you can see if you elected to have treatment downtown. So, you just kind of introduce you.
Cancer centers, as they become more prestigious in certain aspects, they have to have clinical trial portfolio. What that
I mentioned gynecologic oncology. These are our two gynecologic oncologists, Dr. Kofer, Dr. Saunders. Dr. Saunders typically stays west and Dr. Kofer downtown, but that just gives you kind of a face with a name. We also offer diagnostic breast services. Downtown is the one that is specifically with Thompson, but Covenant Health has breast centers at the locations where we have centers across East Tennessee. So, you know, again, if you want to stay with Thompson for that, you go to downtown Knoxville, but it's available at all of our centers and they work together. Downtown, our radiation, or our radiologist is board certified fellowship trained in women's radiology. So she's very good at spotting things that sometimes other radiologists might not find as quickly. We also have all of the latest technology for that diagnostic imaging. So 3D imaging,
Ultrasound.
yeah, ultrasound, just all of those new technologies down there. Okay, move on to proton. Does anybody have questions about the other before I move on? Yeah.
When you have a woman going for mammography, and if they should have something questionable, do they have the services where they will send them immediately right at that facility? The doctor is there, so you have the radiologist reading the results, and the doctor will be there?
That's a great question.
The only reason I ask is because that was, have you ever heard of Elizabeth Wendy Breast Center? That was in upstate New York, in Rochester, and that was the protocol, you know, for their mammographies.
I know that they have the ability to do the biopsy and the testing.
Right then and there that day?
Yeah, the ability to. Now, as far as, you know, common practice, that's a great question that I need to delve
Scheduling
into.
and all that.
Yeah.
Could be a challenge.
Yeah, so, but I know they have the ability to do that right then and there, and whether or not they do it that day, I would assume they do, but I don't know for sure. I don't know for sure.
But if you come up with a mammogram that shows something, a 3D that shows something,
They're
and
gonna
they
schedule it.
bring you back in, and then they'll zoom in on a certain area, and then if that is still questionable, they'll take you directly to get an ultrasound, and the radiologist is right there. So, I mean, you move from one room to the other room, and then the radiologist looks at it. So, you know right away that, it's nothing. And
And
it is
that's all
something,
in that same facility the same day?
yes, but it's a radiologist. I mean, but a radiologist is a physician. So, but it is, yes, it all happens within the same. Now, this is not through Thompson, okay, but where I go, that's exactly that's their process. So it all happens really quickly.
Right.
And before you get onto the proton center, there's one thing I just have to really stress is it's so critical that you have a good primary care physician. That is number one, because if you do, and if they know your history, they'll do, on your annual blood work, they'll check for pancreatic enzymes. So they'll check for anything that you need if you have history, and they will get you in for a lung CT scan if you don't meet the criteria of, or they'll cheat the criteria to get you in. You know, they'll say you were a smoker, even if you weren't. No, seriously.
It's called creative writing.
You know, it is, it really is, you know, so you can get in and Medicare can cover it, you know, but the costs aren't that high, even if you had to. If you had a concern, like a standard low-dose CT scan costs $250, you know, I mean, they're just not huge costs anyway. But you can get them where they're totally covered by Medicare. I mean, so I just really suggest having a really good PA and primary care physician.
The
It's
other
really
thing I'm
key.
wondering, with mammograms, I haven't gone yet here. So, according to density of breast tissue, they will recommend ultrasounds along with your mammograms. Do they do that?
Yes.
Okay.
And as a first-time
Mandatory.
mammogram receiver.
Really?
Yeah, because I just hit my milestone birthday.
Oh, that's true.
So,
Such a kid.
no
kidding.
Well, thank you. I went Northwest. They got a little diagnostic center. It was in and out, and they were so thoughtful and guided me through the whole process. But they said, just so you know, you're getting a 3D mammography. I don't even think that they really typically do anything but 3D anymore. And that just helps see through the dense breast tissue. They help position the equipment around, so she's like, don't even move, just stand here and relax. And so it was really nice to have somebody explain that to me about what I was getting, what was happening, and that it kind of laid to rest some of my concerns about the, dense tissue, and what if I have to do something different? What if they see something? And they said, we will call you no matter what. We'll call you as soon as it's read and let you know one way or the other. And they did.
Yeah, it's very kind of, it's actually really good that they call you no matter what, because you can't, I used to go to a different facility for my mammogram, and they'd say, well, we'll call you if there's something wrong. Well, guess what? You might have lost my
Missed my
stuff.
call, not forgotten.
Or, yeah, exactly. Like, you know how cell phones are? You could sometimes miss a call or not even know somebody called. So it's good that they'll call you either way.
And the state of Tennessee requires if you have dense breast tissue, the state of Tennessee is regulated that says you can get an ultrasound. I mean, it says, when you get your formal letter, it says the state of Tennessee, we are required to notify you that. So it is actually a state law also. So that's a great thing.
Anything else? Okay. Well, we're going to move on and talk a little bit about proton therapy now. Anybody in here familiar with or heard of proton therapy? So proton therapy is a form of radiation therapy. It is somewhat scarce in the United States. We were the 14th center in the United States to have proton therapy back in 2014. And today we have 42 centers, or there are 42 centers in the United States. Very special, very hallmark of big city cancer care. All of those big cancer care centers have proton therapy. It is not experimental, even though it is scarce. And so I want to just explain to you some more of what it's about. And this is our center here, located in West Knoxville in the Dow Springs area, so kind of between downtown and West Knoxville.
So that's the one center within
The one
Thompson
center.
that has the proton.
In all of East Tennessee.
Oh, in all of these.
In all of East Tennessee. So you can see up here on the map where the centers are located. And Nashville has one. Incidentally, the Covenant bought the Proton Center last year, but in 2014, the company that had the Proton Center built one in Nashville too. Well, not in 2014, a little bit later, but so it's the same, technology and all that kind of stuff. But very special for us to have. So proton therapy, again, it's not experimental, it is safe, it is effective. The main purpose of this form of external beam radiation therapy is to spare side effects. And she mentioned earlier that 75% of people with cancer survive. So if you're going to survive cancer, you need to be thinking about the long-term effects that the treatments that you've had could have on your body and your quality of life. So again, proton therapy, radiation, different delivery, and it's more specialized that we will learn, but it is radiation therapy, same as, other radiation therapy is, just in another form. So the difference is side effects and the way it's delivered. Okay, that's what I want you to remember. It's covered by most insurance, including Medicare. I believe Medicare started approving it in our FDA approved it in '87. Medicare started approving it in, I want to say 94. Anyway, it's been a while. Okay. The first center to start delivering proton therapy was in 1991 in California at Loma Linda. So that gives you an idea of kind of how new the technology is or how long it's been around. And it's not only for prostate cancer. Now, a lot of people, when they think of proton therapy, that's all they think about. It will work on solid mass tumors in the body. And won't work on all of them. I mean, it could, but it's not the best treatment for all of them. So if the best thing to do is, if you have a solid mass tumor or someone that you know does, go for a consult and see. There are some things, for example, some lung cancers are better off treated by conventional radiation because of the movement of breathing or other things, right? So the only way to know is to go have a consult and see.
Just a quick question. I don't know a lot about the different types of cancer. So this proton therapy is for solid mass tumors, whereas it's not for not solid mass. What's solid?
Right.
Is
So,
it soft tissue?
like different blood cancers, so
Okay,
like
all right.
leukemias
Yeah.
and things like that, that would be not a solid tumor.
Okay, right. So I mean, it's for tumors,
Yes.
not for another type of cancer.
Yes, and
Okay,
so what
got it. I got it.
radiation does
Okay, I was
is,
thinking there's a different type of solid mass and non-solid mass, but you're
Right.
just saying different types broadly. Okay,
yeah,
very
so
clear.
what radiation does is, it focuses an X-ray beam, a beam of energy onto, any form of radiation, onto a tumor, and it damages the tumor so that the tumor breaks up, dies, whatever the hope is that the whole tumor dies, right? So the difference, let's see if I'm ready to get it back. Yes, I am. Okay, so regular radiation that you just have always heard about all these years is a beam that is sort of a wide beam that of radiation that comes into your body. It can be programmed where to go, and it hits the tumor, and that's good, and it covers the whole tumor, and then it continues through the rest of the body, and it continues to deposit energy through the rest of the body. And the beam is, because it is wide, it tends to hit tissues and organs that are around the tumor as well, which is where you can get some of the damaging side effects. So you have to worry about or consider that there is an entry dose coming in of radiation. There's what hits the tumor, which is what you want. There's what hits around the tumor and the entry, and then there's what's going out, okay? So you have to think about that. So let me show the difference between proton therapy and regular.
Are those damages that you mentioned at the surrounding areas, are those typically permanent or?
Can be.
They can be.
Can
Okay.
be. We'll
All right.
talk about that. So here you see regular radiation, the red. Wide beam, hit the tumor, keep going through. This is proton. It's a much more narrow beam. It comes into the body, it deposits its energy on the tumor, and it stops. Okay? This isn't magic. Okay? There is a way that this happens. Protons are particles, unlike regular radiation, that have a mass and they have a charge. Your body is full of charged cells and chemicals, and so the protons having a charge, they use magnets to direct the protons of where to go in your body. Now, one of the things that the physicists and the dosimetrists use to program where that is to go is the concept of a Bragg peak, which is a property that protons have. And what that means is, because of their charge, not to get too into the weeds, but the Bragg curve is a measure of how much radiation is deposited from the protons carrying the energy as it moves through the body. Okay? And with that charge, they are able to then, at the peak of that deposit, determine where they want that to be in the body. At that point, where they have programmed that because of the charges for that proton to drop all that energy or that big bundle of energy, they're able to program that, and then it stops. It does not keep depositing energy and going throughout the rest of the body. Does that make sense to everybody?
Excellent,
Yeah, it is.
excellent
It's
explanation.
complex,
It
right?
sounds like it's extremely targeted, they
It's
use
very
magnets to kind of map out the boundaries. It's kind of like George Jetson. George Jetson would have this, right?
Yeah,
Now,
yeah.
where are these magnets placed? Are they
Okay, so
external
the
or
magnets are
internal?
not in you. The magnets are what is directing the proton beam, okay? What is in you are the charges that charge entering your body is attracted to.
Right.
And that's the
Positive and
use of the
negative
magnets, right? So to direct that where it's to go.
Well, it's kind of like a headlight, like the regular radiation, and this is like a laser.
Yeah.
I mean, it's to
Yeah.
kind
Now-
of range.
Y'all, it gets a lot more complex
Sure,
than that.
but-
I mean, it's a lot more complex
Of course.
than that. And magnets are used in many different ways throughout this process. But for you understanding how that technology works in your body, that kind of gives you a high level view. Now, that being said, we offer tours of the Proton Center, and I brought some cards today that you can take if you wanted to go see, where you could actually talk very much more specific about the process, see the technology, and all that.
And this would be at West.
At the, yes, at Dow Springs, yes. So, just to show you up here what I just explained. The red is regular radiation, the red curve. And I want you to think of it like this is skin, and this is the level of radiation. So when you get regular, and this is the tumor. So when you get regular radiation, you know, you're gonna have it come in, it's gonna deposit at a high level all the way through, depositing less and less energy as it goes through. Whereas the protons, they're gonna come in at a real low level of energy, and using that Bragg curve, when they hit the Bragg peak, the height of their energy, they're gonna deposit it where the physicist and dosimetrist have programmed them to deposit it. And then they stop. Done. No more use, no more energy. Over. Okay. Let's look at the other thing about proton therapy. It uses something called pencil beam scanning. So the patient comes in, the beam comes in, and it is programmed to paint the tumor, and it can deposit different levels of energy at different places, even within the tumor. So
Is that a virtual painting, not a real painting?
not a real painting.
Yeah,
It
it's a
is
virtual.
though, you
Yeah.
know, it's the concept,
Yes.
right? So
Yeah.
it's the beam doing, you know,
That's unbelievable.
yeah.
So it's the whole tumor.
Yes,
It's not just hitting one spot, it's being
yes,
directed throughout the entire thing.
yes. And it's sparing all of
Everything
those
around it.
surrounding tissues.
So what,
Yeah.
wouldn't everybody who has a tumor use this type of therapy?
Well, again, some of the things are because of where they are in the body. Some tumors are better not treated with proton. Because you have to think something that is so highly targeted, if you have a place in your body that's moving a lot, then that's not going to be the best for there. There are also things like there are some cancers that tend to, like, what comes to my mind, and again, I'm not a doctor, so don't quote me on this, but I've personally dealt with this in my family. There's some brain tumors that have kind of seeds that hide, right, all through the brain. So something that was so targeted and specific, and I'm not saying they aren't used to treat this, they may be, okay, I'm not a doctor again. But something that was so highly specific, they might prefer to have a wider beam to try to catch some of that they couldn't see.
Sure.
Does that make sense? So, yeah.
What, maybe you're gonna cover this, is what cancers is proton therapy most being used on today?
Yep. Okay, let's see if that's what's next. Okay, here you go, up here. So as you can see, solid mass tumors. There are brain and spine, breast, head and neck, oral. I'll show you in a minute oral cancer and why that makes a huge difference with head and neck. So yeah, it's used a ton in pediatric. It is the preferred radiation treatment for pediatric patients because of their rapidly changing bodies and developing cells. So we really want to spare healthy tissues with them. So let's just think about breast cancer. Okay, left-sided breast cancer. What's important here?
The heart.
The heart, right? So have any of you known breast cancer survivors who had radiation therapy and then later on they started developing cardiovascular issues, maybe had to have a stent placed? Okay, it's very common for women who have had breast cancer that has had regular radiation. They survive, but then years down the road they start having issues with their heart. The reason why is because the heart, and specifically the LAD artery, are very susceptible to damage from radiation. And especially, particularly that artery, radiation can cause it to harden. So over time, you have side effects like that. Some people have to have stents and things like that. Well, with proton therapy, that would be a great reason to use it. So for regular radiation, see how it comes in? But if you have proton, it's going to come in, hit the tumor, spare the heart, right? So less damage and fewer side effects. I want to show you up here. This is a plan. These are plans for radiation therapy. This one is regular. This one is proton therapy. These are called isodose radiation maps. All that means is it shows you where the intensity and where the energy is deposited. Y'all understand how to read a weather map? Okay, like when there are all these storms around, it's the same thing, same concept. Red is where the most energy is, and then it goes out from there, right? So purple would be the least, green right in the middle. This is a brain, okay? This is treatment for a brain tumor. We've got all these critical structures in the brain, but the tumor is just right here. Here you see that with regular radiation, it's going to do a wash of radiation over the whole brain. But with proton, they can program it so that it hits the tumor and spares the critical structures. Okay.
That's amazing.
Yeah, it is amazing. So prostate, okay. Up here, you have regular radiation. All the blue is the low dose wash, right? All the extra. Incidentally, the prostate is one of the deepest organs in the body. So there's a lot to be affected if the prostate is if everything around is radiated, right? Your bladder, your rectum, people sometimes have erectile dysfunction and those type of problems. If you're gonna live a long time, you need to think about those things, right? That's quality of life for people who survive. And prostate cancer patients typically survive. So over here, now it looks like that it goes all the way through, doesn't it? If you're looking at the beam. Well, okay, you can see that those critical structures, bladder, rectum, they're spared. For the most part, they get a little bit, but for the most part. So it's going to minimize those side effects. But the reason that this beam looks like it goes all the way through is because the way prostate cancer treatments are treated, they are on the table on one side and it goes in and stops. And then they rotate it and it goes in on this side and stops. That's to get the maximum energy going to that deep organ in the body. That's how they have to do it.
Do you know what is, this is a little bit related, do you know what the PSA measures?
You know what, I used to, because I used to deal with it all the time. That was like 10 years ago.
I figure it has something to do with the prostate, something to do with the likelihood of cancer, and I
Yes,
know
it
that.
is, definitely.
Google it.
Yeah,
Well, I
it is
will,
an indicator.
but I do know that insurance companies, you know, when people are getting medically underwritten, they'll ask gentlemen, you know, what their PSA score, and they'll often say, we don't like you, so to speak, we don't want you if it's over a certain number, so.
But the problem with that is as a man ages, the PSA naturally goes up.
Well, there's a level though at which they say, now we need to do a biopsy.
Yeah.
Because
So it's
this,
like over 5.
it's over what is normal to go up. I do know that.
And other things can affect it, like infection.
Yeah.
And if it jumps radically, I mean, if you have an enlarged prostate, 5 may be normal depending on how it keeps going up. But if it went like to 10, or then,
Yeah.
yes, then it's 5.
Which just emphasizes the need to have regular screening.
Okay, here's the problem. Medicare refuses to allow PSA testing or examinations beyond, I think it's 70, 72.
Well,
Or they'll tell you you don't need to see
yeah.
the urologist for that after a certain age.
I mean, so my husband gets it done when he donates blood. I mean, that's
And
an
a rectal
option.
exam?
No,
it's the
PSA.
PSA.
All right, but,
When they draw blood, they send it off for a PSA level. I mean, that's one. So yeah.
but the exam, they will not.
Right, I went to my urologist, and after I turned 70, it was like, you don't have to come back every year, you can come back every 2 years. And I said, well, I would feel kind of dumb, not dumb, but if I had a cancer and it was because I didn't come back that year.
Yeah.
And his response to me was, is at your age, you would die with the cancer rather than die of the cancer.
Is that your doctor here?
No.
Well, maybe we should find you a doctor.
Well, they do the same thing with women with,
They do. You're right. You're right.
With what?
with the gynecological
Oh.
packs.
So that you need them
And
less
the breast, you
frequently
don't
as
need
we
it every
age.
year.
Well, the CDC keeps going back and forth
Right.
about
Right.
what age groups and what intervals is prudent.
Right.
And
There
I
are
questioned the
national
insurance
standards.
company, because when I spoke with them, I said, I don't understand. You're encouraging people to maintain a healthy lifestyle, and instead of allowing these screenings to be done on a regular basis, you'd rather pay for something when the problem is there instead of looking to get ahead of it.
Yeah.
And there's no answer.
Yeah.
Wow.
That's frustrating. I'm happy to research and get back to you on some options. So,
No, I'm just saying that that's, to me, once you reached 70, it was like, whatever happens. it's,
yeah,
you know,
so
it's,
I don't know, because we have lots of patients at the Proton Center.
Well, I'm just saying, that to
Yeah.
me, that was their attitude.
Yeah.
You know, it wasn't anything malicious or anything. It's like, hey, you're 70, you know?
So you can still do it, it just would be out of pocket. instead
Well,
of
and
having
here's
to
the
go
thing,
away.
actually, you can't, you would think so, but legally, if you're on Medicare or a Medicare insurance plan, besides Medicare or whatever replacement plan, you can't, the doctor's not allowed to bill you self-pay. I mean, because.
What?
Yeah, because it could
Really?
look like fraud, so, yeah, they're not supposed to.
So if someone wanted to, for whatever, there's a family history, fill in the blank issue, prostate or something else, you can't pay for your.
What you could do is have them bill the insurance, get it denied, and then pay directly. But he can't just say, well, we just won't run it through Medicare or a Medicare plan, we'll just charge you. They can't do that. It's
I'm
illegal.
glad you're here.
There's
Yeah,
Like, mine should get sick.
It's to prevent fraud, even though it seems
Well, yeah,
counterintuitive, there was fraud that put a stop to it.
Yeah, I'm sure a lot of those things go in because of abuse, you're right, yeah. That's
Okay.
bad.
I'm told I gotta move on.
Yeah.
I want to show you the head and neck cancer I was referring to and kind of the extra radiation. Up here is a regular plan for a tumor that's found in this, or this is proton, for a tumor that's found in this area. You see the beam comes in at a low dose, gets deposited, stops, spares the eyes, nose, mouth, throat. So, big deal. A lot of people that get their head and neck radiated, they might lose their teeth.
That's a big thing, a lot of
Things
dental
like
things.
Yeah,
Wow.
so
Huge.
this is huge. Here you go, regular. You see all that is hit, plus the tumor. This over here, if you put this up and you subtracted the proton, this is what would be left. It's called a subtractive plan. They look at this when they're doing the planning. All of the green, so remember, that's not the low dose radiation, that's mid-range, affects all these areas in this amount. The equivalent, who's had an oral x-ray at the dentist? They put on a lead apron, leave the room, ask the women if they're pregnant, like 9 yards. This green is the equivalent of 5 million dental x-rays.
Oh my gosh. Oh my gosh.
Oh my gosh.
Oh
It's
my
right.
gosh, that is staggering.
I want the apron on my neck. And
Yeah, I mean,
If you're down.
So, you know,
I'm gonna ask for
again,
that from now on.
you're thinking about, the concept is that we're sparing side effects, both current and future. If you think about how much radiation is in 5 million oral x-rays that the x-ray tech is already having to leave the room and cover up for, that's significant.
Do you glow in the dark?
Get that. Proton therapy patients, and especially the prostate patients, they come in, they're all smiles, they get their treatment, they get on their motorcycles, they go play golf, like, they maintain quality of life throughout the whole thing. Now, some of them, depending on where it is, a head and neck cancer, they might have some side effects that are limiting, but the vast majority of our patients maintain a high quality of life while they're on treatment with proton therapy. So, okay, how do you know if it's right? I'm almost done, okay? Because this is a relatively scarce source, a lot of physicians will not recommend it. They either don't know enough about it, or they have established buddies in the practice that they refer to for radiation, and radiation's radiation, right? So it's going to kill the cancer the same way. Any number of reasons. So if you find out that you or a family member or a friend have a solid mass tumor, check it out. Just have a consult. Most insurance will pay for a consult to see if it's right for you. We talked about how Medicare started covering it way back. Most all insurances cover proton for certain diagnoses, okay? There's not a list, because even within the list, there are often variations. You all, I'm sure, have had dealings with insurance companies, and know there are always, you know, caveats and loopholes and whatever. We have a full finance team at the Proton Center that explores all that for you. And if your insurance is denied, but you've been recommended by the physician for proton therapy, they will work tirelessly to get your insurance to cover you. Doctors doing peer-to-peers, all that kind of stuff. Takes that off of your plate. And this is it. This is the last thing. I just have up here, I've thrown a lot at you, where you can go back and get all this information. All About Thompson is found in a cancer resource guide. It's not only going to tell you all about Thompson, but all about cancer too. So that's a great resource. Up here, proton therapy, Thompson Proton.
Are those the same?
You can
Looks like
find
they're different. No, I got
The
this
QR
one.
code?